into the stomach, so it's not really a sterile cavity. Okay, so just to make sure you know that. And then it'll be individualized. They come one per person. I mean, it doesn't get travels from one patient to the next. Your syringe, this is called a Toomey syringe. It has a blunt little tip applicator, and you can see it's pretty big. This is a, looks like a 70 cc, 80 cc syringe, okay? And if you're opening something new, I always tell students to just kind of play with this. Play with just the manipulation of up and down, because you don't realize how much force you have to push on these things, especially when you give medications, because if you don't crush things properly, it's very difficult to, you know, get the food down and stuff. All right, so you'll need this. And when you come to the patient's room, there's a few things that you want to make sure that you do. You'll see that this port has 3 areas, prongs. So this one off to the side probably is more for medications administration. The middle one here is for continuous feedings. And then the last one here is kind of like an air vent. So it needs that so that it doesn't create inside the stomach that it's like a vacuum sometimes, or, you know, it just keeps things in place, you know. So they always need something there that would, you know, help keep it in place. It could be also for a balloon of some sort too, to keep it in place so that it doesn't go in and out. So I'm going to be using this port here. If I had a continuous feeding, it's like an IV, and it continually pours into here if the patient wasn't eating by mouth. Because why would a patient have a G-tube if it wasn't having problems swallowing or something? Okay, so if I'm going to give medications, say at 9 o'clock, probably you could turn your continuous feeding like maybe 10 or 15 minutes before you actually give it. So they've digested it, and you want to make sure that you're not getting all this residual. What do I mean by a residual? Residual. There's too much stuff left inside. You know, if you give 50 cc's in the stomach, hopefully it's gone through. You know, it's not sitting in the stomach. If there's too much in the stomach, that says this patient's not digesting it properly. So if I check for residual and I got a lot, because on one of those numbers there it talks about, you know, a residual of 100 or 200 cc's. Can you see that? The number maybe 19 or 20 somewhere down. Okay, so if it's over 200 cc's of residual, we're not going to give this medication because it's not going to be digested. You know, there's something wrong with this. If a patient's not digesting well, what kinds of symptoms would your patient exhibit? If you weren't feeling well and you had a really bad tummy and you were having lots of problems, what kinds of symptoms would you have? Digestive problems. Gas, bloating, couldn't poop, couldn't, you know, maybe the distension on the abdomen, right? So you don't want to see those things when you're giving feedings or when you're ready to give medications. Okay, so first thing is I want you to always look at the site. Before you give any medications, this might be sutured in, so there might be a little gauze that's kind of like wraps around the tube like this. But take a peek underneath there just to make sure that it's in there okay. Okay? So it says in the textbook, before you actually give the medications, you're supposed to check for placement. So bring your whole table close to you. I'm going to take 15 cc, I think it's 30 cc's of air, right? 30 cc's of air.
Yeah.
30 cc's of air. I'm going to take my stethoscope. I'm going to listen in the patient's stomach. I'm going to take the little notch there, and I'm going to put my syringe on. And and I'm going to inject air in pretty quick. Okay, what I should be hearing is a swoosh, showing that the patient's, it's actually in the stomach. There's no other place where it would be, right? If it was, you know, if it was out, it would be obviously out. But I guess we're just doing this all the time as just assurance that it's in the right place. After I've located and inserted the air, then I'm going to aspirate. I'm going to aspirate and just pull the syringe back. So I want you to pull until you get resistance. When you get resistance, that tells me that there's no other, you know, no food down there, there's no greater residual. So when it's greater than 200, what are we gonna do? Not give it. Let the doctor know. I wouldn't give the medication, and probably, I don't know if it says to give it back, but at least identify, hey, you know, this is not going in. And just say, either I give this patient a rest so that it doesn't, you know, I might give it back, I'm not sure, but I might give it back. Okay, unless it's curdled or something. Unless something's undigested, then I wouldn't take it out, throw it, discard it. So I'm getting the resistance, and so I've got maybe 5 cc's of residual, then I'll push this back, and now I'm going to get ready for my medications. Every time you leave the patient's bedside with an NG tube, you need to put that clamp on because you're going to have a bloody mess. Okay, it's going to be all over you. And when you put this on here, okay, just think of it. If you don't securely push this on here, like I'm like loosey-goosey and I'm just going to do this, and I've got it on, Janice, and I'm pushing the meds. You push it really hard, you're going to get that stuff all over your face. So make sure you push it on really tight, and when you're giving that residual back, push it in. Okay, so now I'm going to take this apart. Get ready for my medications. So I have all my medications all mixed, and when I mix them all up, they'll be in little medication cups, and I'm going to now give my medications. So before I actually, let me go ahead. And I've got gloves on too, by the way. I'll put my syringe on like so, hold it steady, give my first medication, pour it, follow it up with 15 cc's of saline, tap water, let that go down. Once I see the medication go down, I'll take my next cup, pour it in. So I'm not giving and mixing them all up, okay? I'm giving time in between. Then the very last one, you're gonna flush it with 15 to 30, it says in your checklist. So let's say I put in 15, 30 cc's. Just letting that go in. Now if you see it sometimes sluggish like this, which is happening because there's like stuff there. Okay. If it's sluggish like this, then you can go ahead and use your plunger and push it just a little bit to unch it. Okay, once it's all done, you're going to take this off and put this back. So, okay, so let me go really quick and do this as in its entirety so you